All right, Ben Tracy. Ben, thanks very much for that update. Now turning to health news as Congress debates how to cut the high cost of medical care. A new report out today says there is a lot of fat to cut, and many Americans are carrying it. The report says obesity costs the nation's healthcare system as much as $147 billion every year. That adds up to more than 9 cents out of every healthcare dollar. Mark Strassman has more on the personal and public cost of the obesity epidemic.
3 years ago, Tim Lincheski was fighting for his life. He weighed 335 pounds, and the 43-year-old has the photos and the old genes to prove it.
What size you say?
This is 50.
50, and now you are?
36.
Through exercise and diet, he dropped 120 pounds after his alarmed doctor prescribed him heart medication.
And that's what really got me thinking I got to do something or I'm not going to make it.
Tim was like more than 100 million people in the U.S., dangerously overweight, a trend reflected in this map. In 1994, all the states in blue had less than a 20% obesity rate. Fast forward to 2008, and there's only one state left, Colorado, that is below 20%. The CDC defines obesity using the body mass index, or BMI. It's a formula based on someone's height and weight that calculates body fat. For example, a 5'9" adult. A healthy weight would be between 125 and 168 pounds, with a BMI of between 18 and 25. That same adult over 203 pounds would have a BMI above 30 and be considered obese. Doctors say obese patients are more at risk for type 2 diabetes, hypertension, even cancer. On average, obese people spend more than $1,400 per year more for medical expenses, $600 more on prescriptions alone.
The toll of obesity is driving up healthcare costs and crippling the fabric of many communities around the country.
For all the talk of overhauling America's healthcare system, the CDC says real cost savings lie in getting millions of Americans to overhaul their high-fat, low-exercise lifestyles. Mark Strassman, CBS News, Atlanta.